Thank you, Mitch. I'd like to start out by giving you two reasons to really pay explicit attention to the presentation. Number one is to learn who the heck is this company with the longest and the shortest name as a presenting company here today. And second, a lot of you, I think, can relate to the market that we're going after. Basically, what we do is we empower people who test blood that has been donated or to be a recipient of blood in transfusions. It's a specialized in vitro diagnostics area. We're a medical device diagnostics company. We believe this technology we're developing, which is the Aegis automated blood analyzer, has the potential to become the standard of care in this particular space. It was founded in 2000 by two truly world-renowned physician doctors out of Emory, one of whom is here today. We've raised, interestingly, a little over $4 million to date, none of which has been raised by way of equity funding so far. We've presented at several prior investor conferences, but we keep winning NIH STTR grants. We've won 6 grants, 1 U.S. Navy contract, and I like to look at that as saying 7 times industry peer leaders have looked at this technology and have voted it worthy of being funded. We're here today to talk to you about a Series A, $5 million Series A. Think of the automated blood analyzer, which we call Aegis, as really having the potential to address 2 big advantages. One, it's a better, faster, cheaper story based on internal studies so far. And also it has the capability in this space to be a one box or one instrument that has not only the capability of testing today's serological tests, but also new and emerging assays such as molecular and DNA testing all on one box. Those newer tests can be automated, but they often and will require a separate instrument. The market is $900 million worldwide. When you go and you donate blood, your blood goes through a series of tests to determine certainly its type, whether you are transmitting any infectious diseases. Those tests, surprisingly, are still done 70% of the time by truly dedicated lab technicians manually. Even though automated systems have been around in this space for about 11 years, the market as of yet has fully embraced automation. You ask why? Well, it has to do with why and what these competitive systems have. They were basically automated versions of over 20-year-old manual immunoassay assays with inherent limitations. We want to capitalize on that issue or that opportunity. These are internal studies that will still have to be verified out of FDA clinical trials, but the better is in our own internal studies, we've been consistently getting accuracy at the 99 to 100% as compared to the other guys with 95 to 100 in those tests where they can do those tests. We've been able to do these tests anywhere from 20 to 30% faster or shorter turnaround, which is relevant if you're running an ER operation, like in Atlanta, for example, at Grady Hospital. And because of the direct costs, savings based on our assays, we think over time we'll be able to have our sites experience a 10 to 25% cost savings over the typical 5-year life of these systems. That's almost around $200,000 for that 5-year period. What's the market need we're really going after in this market? It's, again, the fact, surprisingly and uncharacteristically, only 30% of this market has adopted automation. They've not really had a real reason or attractive technology to go after. A better, faster, cheaper story and a one box does all provides a lot of that incentive. Equally important, customers in this market are experiencing significant pressures, an increased number of units of blood being tested because of baby boomers. Most blood transfused are people over 50. The FDA continues to mandate new tests. There's continued cost pressures, and automation alone is attractive because it will help eliminate or reduce significantly human testing error or the risks. Our timelines are as such. The takeaway on this slide are really 2 points. We're doing an A, B, C round. $20 million in total is what we need to raise to get to break even. $5 million is what we're here talking to you about today. It will complete our product development and get us in the FDA clinical trials. And compared to other life sciences, particularly therapeutics or drugs, we actually are a short time to market story. We're 18 to 24 months from experiencing revenues outside the U.S. and inside the U.S. respectively much shorter timelines, much lower cost investment, much less regulatory and clinical risk compared to, let's say, drug therapies. All right, I gave you 2 reasons why to listen. As investors, let me finish with 3 other reasons why you hopefully will stop by our booth. One is the market. This is a very interesting market, ripe for automation. They've not had a truly enabling leapfrog technology to do that. We offer that with our Aegis automated blood analyzer. Remember it to be proven, to be confirmed in studies, FDA studies, but there's a lot of empirical evidence because what we use is automated fluorescent cytometry, which has been around for quite a while but not applied in this market. And there's a wealth of information about the exquisite analyses capabilities of that technology. We are a faster, better, cheaper story, one box does all story. I didn't mention, but we have 15 filed patents, 3 have already issued. And finally, and probably most importantly, why invest or consider us? We're an attractive investment. Contrary to a lot of the stories earlier today, because we're an A round, because we're 18 to 24 months from revenues. Remember Pete Knight's comment about the small insurance company that was a participant in his $3 million round early on at check-free. While we may not be able to necessarily match that, you're certainly going to have the greatest likelihood of return in an earlier round, and I'd like to really give some of you who have interest that opportunity. Thank you very much. I hope you stop by our booth and meet Dr. Rollback, and by all means, continue to donate blood any chance you get. Thank you.